to establish the lay of the land and why we're doing this particular show. Dr. Vincent Rajkumar, the cases of black fungus or mucormycosis are on the rise, and through many conversations with many doctors, I've understood that that could be fatal. There are facial disfigurations, somebody is having to remove their eyes, there is a whole host of multiple doctors that are required to even treat a black fungus cases, a patient. If you could explain black fungus, mucormycosis, and the fact that this is probably a result of the non-judicious use of steroids in our country.
So, I think there are multiple factors that are responsible for mucormycosis, one of which is diabetes. Diabetes is more prevalent in India, and high blood sugars, uncontrolled diabetes, even without steroids, is a big risk factor. When you give steroids, blood sugars go up. You can make someone diabetic by high doses of steroids. So if you are already diabetic and then you add steroids, then you have a double whammy, and that increases the risk. The third problem is many of our patients in India are getting antibiotics, which, again, are not necessary for COVID, whether it's azithromycin or doxycycline. These are broad-spectrum antibiotics that disrupt the normal flora of the body. So what happens is then fungus, like black fungus or candida, can grow. So you have these three factors: the antibiotic use, the steroids, the high blood sugars from diabetes, and particularly if they're not controlled well. You have a immunosuppressed patient that is just susceptible to something like this happening. I am not sure what the other factors are. If there is something else that we need to be concerned about, particularly the oxygen. And I'm just hearing reports of mucor and amphotericin B shortages, which is just stunning to me, because, that's not something we have encountered in the US with so many thousands. As you know, we have 33 million COVID patients in the US diagnosed. I'm just puzzled about that problem.
And also, if you could give us a little bit of perspective. Remember, you and I were talking about the cancer research that you're doing, and when you administer steroids, it's actually used to kill those particular cancer cells, and link it to now what it does to when you administer it non-judiciously on COVID patients, Dr. Vincent.
Yes. I'm a cancer researcher, and one of my contributions to cancer research is finding out that high doses of steroids harms patients. So I treat a cancer called multiple myeloma, and it is the cancer of plasma cells. Now, plasma cells are the cells that make antibodies and help us fight infection. Now, whether you get a vaccine or a viral infection, the antibodies are the ones that come up. Now, we use steroids to kill plasma cells. So that's how powerful these drugs are in immunosuppressing someone. And so what we found in the studies that I did, I'm talking about almost 20 years ago, is that high doses of steroids cause higher risk of death, higher risk of blood clots, higher risk of infections. And we now, even in the cancer situation for multiple myeloma, have now routinely started using only low-dose steroids. The recovery trial used, I think, 6 milligrams of dexamethasone. Sometimes if dexamethasone is in shortage, they use Visalone or prednisolone or solumedrol, and there are equivalent doses. But the doses I'm seeing sometimes are 5-10 times higher, and for much longer duration, and that's where the problems happen.
Absolutely. Dr. Prateet Samdani,